Today I will teach you the main theoretical rules on how balance method was invented. Who invented? What the structure behind? What is the balance method? Why we call it the balance method? Because it balances the whole body. But how do we know about it? I learned balance method from Dr. Tan, Dr. Richard Tan, who was amazing practitioner, absolutely great master. But Dr. Tan learned it from Dr. Chao Chen. And Dr. Chao Chen presented the balance method in the Congress of Acupuncturists in 1966. And this method had absolutely tremendous success because people who had arthritis for 30 years, after 2 minutes, stopped feeling pains. People who had disorders with history, local disorders, they stopped feeling pains. And that created a big event in the acupuncturist community. Dr. Chao Chen got balance method from I Ching. You know what I Ching is? Oldest Chinese book written about, let's say, about everything. In I Ching, you can see 64 hexagrams. What are the hexagrams? Like lines. 64 with different interpretations. The yin line consists of 2 bars, 2 little bars, and the yang line, or we call it yao, is long. So Dr. Chao Chen investigated deeply hexagrams of I Ching, and he came up with the relationships between so-called meridians or acupuncture channels. So this deep knowledge was published for the first time in 1966. But Dr. Chao Chen was an academic, very academic person. So he has not been able to present this method to acupuncture community as well as presented to Dr. Richard Tan. So Dr. Richard Tan popularized it, and his website was called Dr. Tan Show. So he managed to present it in such digestive way that we can learn, understand, and remember it in 2 days. So you won't believe, but after, possibly not the first lecture, but after the second one, you already will be able to treat any possible pain. We're talking about neuropathic pains. But 97%, according to modern research, is neuropathic pain. Even arthritis should not be painful. My father, he worked in a desert called Gobi, Mongolian desert. He was a paleontologist. And he developed arthritis when he was 35 because he injured his knee, and eventually by the age 70 his cartilage was wasted completely. So X-ray showed bone to bone structure. There is no pad in between. He refused my needles because he said, Katya, that won't be any result. I don't have cartilage. I don't have pad in between. I kept telling him that the bone doesn't have nerve receptors. It must not be painful. There is something else. It's a nerve tissue. There is poor blood circulation around this bone, around the kneecap. And I put some needles eventually. He allowed me. Guys, no pain. No pain at all. So everything is possible. Sometimes we think, oh, person need an operation because there is no pad between the vertebrae. Balance method can sort it out. It can be just a neuropathic pain.